I've done about 3,000 implants at this point. I've removed about 10, 15. The whole procedure really has become the Chicago treatment, where it's a tailor-made approach to your specific jawline, your specific neck and face demarcation, kind of drawing those lines, those peaks, those valleys. All right, hello, Dr. Benjamin Coughlin, facial plastic surgeon. I'm essentially super subspecialized now into this kind of lower third jawline area. Today we're talking about chin implants. So chin implants can be extremely powerful for people. The classic person that's seeing me now that needs a chin implant, they're thin, or at their thinnest, they still had this problem. So, because you can also be heavy and still need a chin implant, or thin and need a chin implant. But when people come and see me and they're like, you know what, I just don't like this area. The face, the neck, they're kind of blending together. There's something I don't like. I had a patient call it the face cankle. You see what a cankle is like, where things blend together. In the face and the neck, we like that clear demarcation, you know? So, and part of what leads to that is the structure of the face. So, you know, the jawbone, the mandible, it's a big bone. There's a lot of bone stock here, you know? Those 100-year-old people walking all crunched over, that's because their bones are smaller. Their femur's smaller, their spine's smaller. This bone gets smaller as you age. As you age in every dimension, it kind of shrinks down. So that leads to a lack of demarcation of that jawline, of that structure. So that's one key thing that leads to people kind of needing this. You know, I say that in quotation. So chin implants, what are they made of? Really common question I get. We have silicone, we have MedPort, and we have like a polyethylene mesh I use. But the chin implants go like this. This is just a model. You can see I have this company making these heads for me for before and afters to show people kind of 3D. It's pretty cool, but this is a kind of how the chin implant goes. And you can give anterior projection, you can give inferior projection, you can kind of change. That's really important. A lot of surgeons don't appreciate that. You can also contour these things, make them finer, round, square, all that for the patients. And then the other common question I get, do you have to exchange these? So, you know, breast implants, you got to swap out every 10 or 15 years because the breasts are pendulous, they stretch. Chin implants are yours forever. You never have to swap them out. They go with you to your next location, I say. And then, you know, the other thing, you can remove them. They're really easy to remove. So it's too big, it's too small. A couple guys want a bigger one, so I pull it out, put a bigger one in for them. They slide right out. They're pretty easy to recover from. You don't want to get to that point because it's another surgery, but still you can. I've done about 3,000 implants at this point. I've removed about 10, 15. So, you know, a couple people want bigger ones. They can get infected. So I never want to downplay the bad parts of these. You do have a little bit more of an incision under the chin when it's an implant. So there's definitely more that goes into it, but it's a great option for many people to really get that look. The structure is a big thing in people. Of course, the fat is also in place, so I manipulate the fat. You know, every time I do a chin implant on somebody, I always liposculpt under it and around it so that the tissues re-drape around the implant. So that's one thing I do uniquely that can really help people kind of get that contour. So it comes down to the anatomy. It comes down to the three-dimensional volumetric redistribution of the face fat and structure. It really is an architectural phenomenon, the way we get this jawline to pop, because it needs to move in all these different directions. You want the mandible project through the skin, so into the soft tissues. That's why chin implants are really important. And the key really comes down to the chin tip to the hyoid bone relationship. When we like a nice sharp jawline is when these are parallel to the ground, or even when there's a little bit of a negative, acuter angle there, a more acute angle. When you start to get that kind of upward contour, that upward slope, that more obtuse cervical mental angle, that's when people come and see me. Laterally, kind of to the side, when you can't see that SCM, when you can't see the ramus and body of the mandible, those people come and see me, and that's when the chin implants become important. So typically you come in, I go over, first we talk about your goals and what you want. Then there's some metrics we use to kind of line up different portions of the face. So I have different calipers, different things I can use to show you. You line up the lips, upper lip, lower lip, should touch the chin margin there. So it doesn't mean it has to, it means we can use that to further project into the face to define the face and neck, to define those peaks and valleys that people are after. So we mark your face out, I pull up your photos, we go over facial thirds, facial fifths, anterior projection, inferior projection, the width of the progonion of the angle of the mandible here. So all of those things come into play on how we get you what you want. And then it really comes down to your goals versus what I can supply. So I say this a lot, but I got people over here that show me literal avatar photos, and I got people over here that don't want their spouse to know that they had surgery. So most people fall somewhere in that ticker there, right around the 7 to 8 mark, with the, closer to the avatar these days, it seems like. And I'm kind of being funny there, but you know, really that a really exaggerated look is right for some people. In some people, the more natural, smoother result is better. I can do it all. The goal is to make you happy, not me. So I'll give you my advice. I'll do a facial analysis and show you what I think will work best for you to get you kind of that sharpest look. And this is where, you know, inspo photos, inspirational photos are really helpful. So you bring me Angelina Jolie, I get a little bit of a vibe of the kind of, she has a little bit more of a square chin. Ariana Grande, a little finer, a little more sharp. So those photos really do help me. You don't want to look like somebody else, but they do help me see the aesthetic that you like. You know, I have my own personal aesthetic. We want to be closer to yours, not mine necessarily. So all of these procedures, now almost all of them, I'm doing fully awake. I do give you a little chill pill, a combination of medications that get you kind of like having a little buzz, but I do them with local anesthesia. I do that for a couple reasons. Number one, it's safer. Safety first, always. Number two, I think the results are a little bit better when you do it awake, because when you turn, you can see that sternocleidomastoid to the contralateral side flex. Same thing here. And when you put your head up, it helps me see those angles, those peaks, those valleys. When someone's flaccid and paralyzed while they're asleep for anesthesia, it's really hard to get those looks. I do it to some people where we have to put them to sleep for whatever reason, but I think the results are a little better awake, and of course, again, it's safer. It also saves a little bit of money, so everybody likes to save money. So, because you don't have to pay the anesthesiologist, you don't have to pay for the surgical center fees. So for those reasons, everybody pretty much is awake now. You go home same day. The majority of my patients are flying in, so if you're flying in for a chin implant, I like you to stay 2 nights. If it's just the buccal, jawline, you know, 1 night is typically adequate. A lot of times in combination with chin implants. Like I said, I do jawline sculpting all the way back to here to here. A lot of people do buccal fat because that helps me saddle that mandible. When you push in here and you push in here together, you can see that bone pop out a little more. So that's one of the benefits of the combination procedure. The key really is to do a good facial analysis, a good aesthetic assessment, you and I having a discussion about your goals and what you want, and then I give you the recommendations on how I think I can get you there with these hands. So that's the goal, that's the Chicago treatment, and that's how, you know, we get happy patients. It's all about happy patients, trust me. I'm at the point now, I'm operating every single day, so I'm doing enough of these procedures. I do not need to do more. I do it for you guys, you know? I wanna make happy patients, I wanna have fun while we're doing it. So, chin implants, Chicago style. Like, subscribe, comment down below. Stay tuned for more plastic surgery, commentary, videos. You're gonna just feel hotter watching them.